real life solutions. I am sitting here taking a small break. I wanted to kind of talk to you all for a bit. And I'll wait for people to come in. I love doing these impromptu these live streams on mental health at the last minute. I got quite a few things to do. Decided to take a small mental break to kind of hang out and have a discussion about the misinformation of mental health that is in social media. And I'm going to kind of talk about, start off with YouTube because that's the platform I'm on the most, but that's heavy misinformation on other platforms also. And I would say YouTube is kind of at the top of the list. I would say TikTok is actually above YouTube as it relates to that. But over the weekend, guys, I was went out of town and everything, went to a family reunion, enjoyed myself, enjoyed my family, enjoyed everybody. We had our 50th family reunion, and I got family from Houston, from Dallas, family from New Orleans, family all over central Louisiana, family. I even had family from California that showed up. Shout out to Miss T. Appreciate you for being here. And so I was watching a lot of content where there was a lot of misinformation about mental health. Some of it was a bit triggering. And this is why I don't watch spaces that I once fraternized in, because I almost flipped the script over the weekend. Basically, I was out of town Friday. Saturday, I watched a little bit of stuff in between, hanging out and, drinking, chilling, enjoying my family. They had all types of activities, and I had really good self-care over the weekend. Really good self-care. On Sunday, all our family, we had church. After church, we had a family reunion picnic and all that stuff. Took pictures together. A lot of my family, they are on Facebook. They're big on Facebook. Most of our information is on Facebook. They don't really deal with YouTube. But what I did notice was that as I was talking to family members, mental health issues did come up. There were some things related to PTSD that came up. And in that situation, there were some family members that didn't understand what PTSD meant, what's the true nature of PTSD, and I had to do some correction. Now, not all of my family members know what I do for a living. Well, what they do know is that I do something within, I have a business, but a lot of family became aware of me as a mental health professional. And they received a lot of miseducation from social media as it relates to PTSD and how people display that type of behavior. And I typically don't get into those conversations in my real life when I'm around family. I'm kind of reserved a little bit. I am sociable but reserved, and I just let people say whatever they want to say, and I just let it go over my. And then my sisters, I have an older sister that's also a therapist like myself, and she does the same thing. We may talk about it amongst ourselves here and there. A lot of times, me and my sister talk a lot about mental health when we are on the phone with each other. Okay, but there was misinformation. I span across, I look through YouTube and I see a lot of redundant behavior in certain spaces. I see a lot of people mentioning things about mental health. And I saw where things were talked about as it relates to bipolar disorder. Um, I saw a lot of information about people talking about things as it relates to mania. And I've seen people reviewing content and making content based on what other professionals may state about mania. And from time to time, I may speak on mania. Mania is a part of bipolar. Mania is a heightened, elevated stage in which people, their mood is elevated. And in the state of somebody's mood being elevated, they can think illogically. They may have flighty thoughts, pressured speech, or fast speech, excessive spending. You may participate in dangerous, thrilling type of behaviors. Difficulty sleeping, difficulty concentrating, unable to complete tasks. In mania, there is a level of impulsivity, okay, that goes about. I just had a client today that, earlier today, that I was seeing, in which they are suffering from mania. And when they are in a heightened stage, they may do a lot of impulsive things that can have long-term effects that they regret. Excuse me. Shout out to Swag TV. She states, when I start going live again, I would love to have you come and have, I would love you to come and have a discussion. I would love to come by. I appreciate it. I appreciate all of that. I love to give psychoeducation on mental health. And so I want people to understand, when you're dealing with mania, we must understand that people who are in a manic state don't stay in that manic state for a long, well, they don't, when they're in a manic state, it varies from person to person. And I want people to understand, although there are clinical features that define mania, it doesn't look the same for everybody. And that's the issues I have with people who discuss mania, or they discuss mental health that are not professionals. They say it in a very generalized way, in which people think that this is how it looks for everybody, and it doesn't. Someone who is diagnosed with schizophrenia, there are different types of schizophrenia. And schizophrenia, let's just say someone is paranoid schizophrenic. One paranoid person, a person who has paranoid schizophrenic, it may look totally different. The delusions, the hallucinations, the paranoid thought processes may display quite different from one person to another. Okay? Shout out to Lemon. Appreciate you for coming in, brother. And so I understand that you cannot expect people who are not trained to know this specifically. But I just want us to be careful within the repetitious thought of certain things, because people think that mania presents one way, and mania doesn't present a certain way, because some people are more severe than others, and some people are able to manage mania better than others. But one thing I want you all to understand, no matter how manic someone is, because the original name for bipolar, the original name is manic depressive. And the reason why it's called manic depressive, because when someone is bipolar manic depressive, they have a heightened stage and then they crash and come down to a depressive state. And that's how we can separate a person who has major depression or clinical depression from someone who has manic depression, because a person who has manic depression, their mood is unstable as it relates to being elevated and downward. A person who is major depressive only stays downward. Okay. Now there's other criteria that come into place. I don't have the DSM here to be clinical, and I think that is not necessary. But it's more for me to give you more of a broader sense of what that looks like and how it can be managed with medication and therapy. Also, I want to preface to everybody, one of the biggest mistakes that is made as it relates to the misinformation of mental health is people assume that a person who is diagnosed with one illness, that's it. They only have that one illness and nothing else. And the fact of the matter is that one of the reasons why bipolar may present different is because some other people, they may have 2 or 3 other mental health diagnoses. Now, when we talk about comorbidity, we misunderstand that a lot of people who are diagnosed with manic depression or bipolar disorder also have a high rate of comorbid symptoms of anxiety. They also may have had a behavioral disorder such as ADHD or ADD. Okay? They may have a personality disorder. They may have some other stress-related disorder. They may also have PTSD. Okay? They may have generalized anxiety. They may have social anxiety. And so we have a tendency to think, and most people who are diagnosed with a mental disorder, whenever they are diagnosed, they are somewhat focused on what is called the primary diagnoses, meaning that this criteria of behaviors all balled up in one seems to present itself and cause more dysfunction in your life than any of the other illnesses that are diagnoses that you may be diagnosed with. Okay? And so they will focus on the fact that they are bipolar. But many of them will not also state that within the realm of my clinical diagnoses and my evaluation, it also states that I may have social anxiety disorder. It may state that I have a phobia. May state that I have a behavioral disorder. It may state that I have the personality disorder. Things of that sort. So I'm glad at this point in this stage of my YouTube presence, I have disciplined myself to reserve from speaking and particularly jumping on panels and interacting with people to course correct and talk about how these illnesses and these symptoms presents itself. And how this may occur over time. I also saying when somebody was talking about hypomania, which is basically a lower level of mania that is a more acute, more short term, and maybe less intense. I've heard people talk about bipolar 1 and bipolar 2, which is a thing. Those are clinical diagnoses. I typically, to be honest with you, bipolar 1 is more severe, bipolar 2 is less, but there's also, as it relates to the severity of it, whether it's mild, moderate, or severe. And then also we have to look at that it also talks about whether or not it's recurrent, in full remission or not, or if there's psychosis or non-psychosis involved. So, and that's why it presents different, because there are different levels as it relates to the most recent episodes okay, or not. So that there's other things that contribute. And when you look at someone who is bipolar, um, most recent mood being severe with psychotic features, it looks totally different than somebody that basically has bipolar and the most recent episode was moderate. It's just a difference. Now I'm getting more clinical than what I need to, but I wanted to state that is because there are people who you will not know, and I see this all the time. There are a lot of high functioning people who are diagnosed with bipolar disorder. Very high. Okay? And so what I want to state is that for myself, because I'm confined as a therapist, I can't say yay or nay whether someone is manic or not, because when I say somebody is manic, it hits different because I am a professional and my ethics states we don't want you saying things that can be misconstrued as a diagnosis because you didn't evaluate them. And also the fact that it's not also the fact that I didn't evaluate them, but because particularly if I'm operating in certain spaces, I could be seen as not being objective. And that's why I tend to, right now, as we speak, and I know I'm from the Umar Johnson sector, I was from the Umar Johnson sector, people are questioning the mental stability of Umar Johnson. We all know about the instability of Umar Johnson's daughter. And then we're also questioning the mental health state of Umar Johnson, which has been in question for years. Okay? And people were thinking that I reserved the right to speak on that because I was a supporter at one time. No, I reserve to speak on that because I know that Umar Johnson is a mental health professional, and he knows that I am a mental health professional, and he knows ethics just as well as I do. And I don't think that he would appreciate me being a licensed professional counselor of basically giving what could be perceived, even though it is not, as a diagnosis to him, and so forth. He would not appreciate that, just like I would not appreciate someone stating that I had a whatever type of diagnoses, and I know my ethics and I know how this is appropriately done within the profession. So what I will say as it relates to mania, the flip side of that is we must understand that if you are diagnosed with bipolar and you're having problems coping with mania, I would encourage you as a mental health professional, and I know I'm going to say something that you all don't like to hear, and I don't care. I don't care. When I speak as a therapist, I don't care what you all think is, because I know what's appropriate and what works in this profession. I've been doing this for over 20 years. I've been licensed in the state of Texas for over 17 years. Okay? Actually, 19 years. What I am going to say is that your medication management is highly important. Very few clients that I have had in the last 20 years are able to manage bipolar disorder on their own through self-care. Very few. I'm not saying it's impossible, but very few. And very few were able to manage bipolar disorder with therapy alone. The best form of treatment is psychopharmacological treatment along with therapy. That proves statistically, research-wise, to be the most effective. There are some people who can manage it with medication alone. There are some people who can manage it with therapy alone. The best form of treatment is with both. Okay? Then also, I saw a person who I had some issues with in the past that was a mental health professional, talking about diet and nutrition. And I question, and he's in the Northeast and he's in the New York area. And I questioned some of his uh, frame of reference as it relates to alternative ways of treating mental illness. And I never, I've always posed for those that want alternative treatments that you seek a qualified medical professional first as it relates to nutritional changes, medication changes, or other natural substances that have been proven to benefit helping mental health. I would encourage you not to do this on your own, but to also, whatever you plan on practicing doing, get an opinion of a medical professional, a medical doctor. Okay? I'm not discouraging or encouraging you to do one or the other, but what I am encouraging you to do is to seek a medical professional. Beware of people who come around with all of these unorthodox forms of treatments. They're saying that they're doing all this quote unquote coaching and interventions and the ketamine treatments and interventions. You know, just beware of that. Not to say that some of this stuff couldn't help. People talking about CBD oils and different things like that. What I'm stating is, as a mental health professional, if you were my client, I'm talking to you as if you were a client that came into my office today and questioned me on alternative forms of treatment for mental health. I am not going to educate my community on this channel for a YouTube persona or for views. I don't care if the person who did whatever quote unquote coaching intervention had 1 million views and I only got 50. Okay? That person had 1 million views they basically miseducated 1 million people. And the 50 people that I talked to, I gave you basically professional information that people pay a lot of money for me to you got it for free, okay? As opposed to somebody miseducating you and and putting you at risk of intensifying whatever symptoms you had that could potentially lead to hospitalization. My fear is that since I've been on YouTube since 2017, I have stopped at least 5 suicide attempts. And my fear is that a lot of what's not talked about a lot is the high level of suicidal attempts, or what I would say reckless behavior that could cause physical harm or something that's detrimental to your health or somebody else by somebody that is in an extreme heightened state of mania. That is my concern. Now, I'm not saying someone has it or not, because I have not evaluated anybody. But my concern is that when I see certain things going on for over 3 to 5 days and a switch starts, but I get concerned to the point where I stop watching. Right now, I don't watch. Matter of fact, I limited watch last week. I watched other things between me interacting with family members and, you know, having a good time and all that good stuff. But people think that mania or manic symptoms are the same for everybody, and it's not. It presents different. The features as it relates to diagnosing bipolar disorder, mania, the symptoms are the same, but they present different. They present different. There are people, and it's another thing that's a myth about mania. People think that a heightened state of mania doesn't always mean that the person is that's fully out of control. There are people who are manic depressive who act in all types of ways. They can be giggly, bubbly. They can be more promiscuous. They can be more touchy-feely. They can laugh a lot, just talk very vibrant, very colorful about a lot of different things. They could talk very inappropriate, joking around about all types of things. It all depends on the personality of that person. Okay. But we also need to understand that when a person has mania for whatever amount of time, they're going to crash. And in my clinical experience, I get concerned. I get concerned when somebody crashes, because when somebody crashes is when they become depressed. Because see, you don't stay manic you're going to crash at some point. And you know what happens when you crash and you become depressed and you go into the depressive side of bipolar? You stop caring about your self-care goes down as it relates to hygiene, brushing your teeth, washing your face, changing clothes, bathing, shower, makeup, combing your hair, cleaning your house, cooking for oneself. You're ignoring taking your medication. You're sleeping for 10 or more hours a day. You forget about work. You stop doing all types of pleasurable activities. As opposed to when you're manic, you may try to do a gazillion things at one time, and you go from doing... And see, bipolar is basically... the epitome of that is that you're going from one severe side to the other severe side. A severe side upward and then a severe side downward. And so, as it relates to that illness and other illnesses, because I hear people talking about autism all the time, the autism spectrum disorder, and I hear about people who think that they're experts and they're not, because their child or some family member exhibits, and autism presents itself differently, although there may be similarities, and there's different levels to functionality, particularly if someone is higher functioning as opposed to someone who is low functioning and nonverbal. Autism look totally different. I actually, and as others in the community that agree with me, that the autism diagnoses needs to be revisited. And I will argue with any organization, any academic setting and environment on that, and be prepared to give a presentation, an argument that is what I would say lucid, and people understanding how when they changed the criteria about 13, 14 years ago, they should have revised it and made it more defined, because that it's so blurred. When people think of schizophrenia, schizophrenia looks different. A lot of people who are homeless, there's a high level of homelessness as it relates to people who are diagnosed with schizophrenia. How their brain function, they're out of touch with reality. But we got to understand that psychotic symptoms can present in other illnesses. It's just not as defined as it relates to full-blown schizophrenia. There are people who were once diagnosed with major depression or bipolar that had psychotic features or schizoaffective disorder, and then untreated, it progressively gets worse till it becomes full-blown schizophrenia, which is to me the most severe mental health illness that there is, in my opinion, and most people would agree with that. Okay, but I wanted to create this video um because I think that I wanted to give a perspective that is an unbiased perspective. Okay, I want to give a perspective that is a clear perspective, a perspective that is objective, and a perspective that just strictly deals with that issue of how social media and the uses of it, we can throw around different terminology and not understand that that could be some level of misinformation. Okay, and that's okay. And to me, I love the fact that there are people, and the community itself, the profession wants people to seek knowledge and to go through psychoeducation. The problem is that when people take in the information and think that they are qualified to give diagnoses, or that they can label people as such, or label themselves, which self-diagnosis, which is unethical, and it's highly I highly discourage that. Okay, and so that those are things that are deemed as problematic in the mental health field. And so, and I'm going to say this, there are people who are self-medicating and they come online, and that does happen. I'm not saying that we should label them and say things, but there are people who self-medicate or they avoid medicating themselves and they come online as a means of coping, which I discourage. So I'm going to speak to people who are diagnosed with a mental illness, particularly any type of mood disorder, any type of thought disorder, pervasive disorder, any type of behavioral disorder, and where you feel that you have to come online to manage your illness or to deal with your illness, that is deemed, from my professional opinion, as a maladaptive way of coping. And if I was your therapist, I would discourage you from social media or your use of social media until you stabilize yourself. Okay? And that's nothing to be ashamed of. And I think the shame that comes with people seeking help, because mental health in some terms is still seen as somewhat taboo. And the shame that comes along with knowing that I need to go to the hospital and I'm not going to the hospital. I literally, guys, walked a guy through the process while he was live, getting ready to do something outlandish. I calmed him down and I walked with him online to checking himself into the hospital. I did that. I've done that several times. I literally had a young lady was online, and she had a personality disorder and a mood disorder, and she was out of control, and she was displaying some very I would say things that would make me concerned. I didn't say she had anything. What I did was I got in there and I talked that person to logging off and contacting a provider. And you know what happened? There were people telling me to shut up. There were people telling me to be quiet and leave her alone. And you know what I did? I continued on doing it. I asked her questions that I would ask anybody that's in a crisis, potentially could be seen as a crisis episode, because I knew what I was doing. They didn't know what I was doing, and that's why I didn't answer, because I know that they didn't understand what I was doing. They were upset that I was asking her certain questions. They thought that I was intensifying the situation. No. What I was doing was I was basically literally asking her questions to see where her mind's, whether it was performative or not. I did that to see where she was at. I told her, hey, I think you need to get off of this live stream and contact your doctor or contact 911 or whatever mental health program that can provide crisis related services for you, and take some time off of you. Look, it is okay, guys. If you are overwhelmed with whatever's going on YouTube, it is okay to take 5 days off, take a week off, take a month off for self-care. It's not going anywhere. The same people that you saw on Tuesday, you're going to see them next Tuesday. They may ask where you're at. They'll be there. They're not going anywhere. It's okay. It's okay to take a break. And I discourage people that have severe mental illness for using YouTube as a tool to cope with mental illness. I discourage it. Now, there may be other professionals that will say, well, it makes you more social and interactive, and that's true. But for me, I've seen more negative outcomes than positive. So I'm going to say nay to that. Not all mental health professionals are going to think the same and are going to give the same suggestions for someone to engage in if they choose to be online. I'm preventive. I'm preventive in nature, and if I think that it's going to harm you, I'm not going to encourage you to continue to do it. That's just that. Okay? So, if anybody has any questions, any mental health related question for me, please ask. I would love to answer any mental health related question. And I'm going to give it a few minutes, and then I'm going to go ahead and get off of here and get back to my work. I got a few other things I got to do. And I plan to get out, be done by, in the next couple of hours. And I got some consulting to do and other different things. I'm waiting to hear back from this company. I got some book reviews that I got coming up. I got to finish up. And I got 2 podcast interviews that I'm hoping that I can review and post on the channel. So does anybody that has a mental health question, please ask me. If you want, you're getting a free service from me. Because I could actually, and I've thought about this, I can basically create memberships. And you can pay a membership. And I can do membership related content where I will get in-depth, because this is very vanilla what I'm doing right now. If I had, where it's confined to you, I would talk about some things. I would talk about some experiences, some clinical stuff. I review cases, vignettes, talk about assessments. I would also give people information on how they could take certain assessments that could help them identify if they potentially have some issues with their own mental health and interpret it. There are assessments, simplified assessments, that could make you aware that something is going on or not, or whether or not you should be concerned. Okay? All right, so I'm giving a little time. Anybody, and I understand people are shy to ask questions, because what ends up happening, people send me emails and they choose not to put anything in the chat. And I get it. That I've been dealing with that for years. People, there's certain issues that they prefer to be anonymous with, or and I get that comes with the nature of this industry. So, with that being said, if there's no other questions, I just wanted to come and talk to you all for a little bit, and just to kind of talk to you all about mental health and the misinformation. And I'm talking about across all platforms, across all sectors. There's a lot of misinformation. There's a lot of misinformation about narcissistic personality disorder. There's a lot of misinformation about PTSD. There is a lot of misinformation about bipolar disorder, major depression, antisocial personality disorder. There is a lot of social anxiety disorder, generalized anxiety disorder. There is a lot of misinformation. And so I hope I can be a place where you will get reliable information. You're talking to, this is a lot, you're seeing, I'm a licensed therapist. I'm ethically bound. I'm not here on this channel to compromise the integrity of my license for views. No. So, with that being said, guys, I'm going to go ahead and get out of here. I appreciate you all for being here. This is D Durrell, D Durrell Life Solution. Have a great day.